Welcome, everyone, to the American Diabetes Association special webinar dedicated to technology and diabetes care, featuring Dr. John Whyte. Dr. Whyte is the Chief Medical Officer of WebMD, the most respected source of health information in the United States. I'm Gil Bash, your host, and I am part of the American Diabetes Association research effort. The ADA is committed to raising awareness and championing research to improve the lives of people with diabetes and their families' well-being. Now a bit about Dr. Whyte. Something I learned about him just moments ago, that he has been an advocate for the use of technology in improving the lives of people with diabetes since 1999, where he spoke about the importance of access to insulin pumps for people with diabetes. And that's possible today for people with type 1. Dr. Whyte is a leading national voice in addressing pressing public health priorities. He's often on national television. He's a go-to expert for government and industry, and one of the nation's top 20 health influencers. Dr. Whyte is also a champion in speaking about connective care and speaks frequently on how digital tools and technologies improve people's well-being. Now, before joining WebMD as the Chief Medical Officer, he was a leader at the Center for Drugs Evaluation and Research at the Food and Drug Administration. And in this role, he championed countless efforts to address diversity in drug development, especially regarding changes in clinical trial design. Dr. Whyte is the author of the best-selling seller in health, Take Control of Your Diabetes. John, I want to welcome you to this special webinar and thank you. And we look forward to your talk here, which will be available also on the American Diabetes Association YouTube channel.
Well, thank you, Gil, for that very kind introduction. Gil is a good friend of mine and is a champion of really how do we communicate health information in the best way. So what I'm going to do is talk for the next 30 to 40 minutes really about the role of technology in the management of diabetes. And I want folks to know to throw some questions in that Q&A box because I'm going to get to as many of them as I can. If I can't answer them today, hopefully I can do it later by email, and I'll have my contact information for you, and I'm happy to address questions. This is a topic that I'm very passionate about. I'm going to put up some slides and happy to share the slides. So, sit back, relax, and let's have a conversation about how we manage diabetes with the use of technology. So here we go. And of course, now let's see here. Now, one of the main ways that technology helps in managing diabetes, as we know, in terms of continuous glucose monitoring. And I'm a big proponent of that for obviously type 1, but also type 2. And what gets frustrating, as many of you know, that some insurance doesn't cover continuous glucose monitoring for patients with type 2 diabetes until they're on insulin. And that's something that we really need to change because technology, continuous glucose monitoring, this device, the size of a quarter, it actually looks bigger than it really is on this picture, can help you identify what are those foods, what are those behaviors that increase glucose, that decrease glucose, that minimize what we call this glycemic excursion, right? So when you have diabetes, you're going to have these big changes in glucose, primarily based on what you eat and how active you are. So I can learn what's going on a continuous basis. That's going to help tremendously. So a big proponent of continuous glucose monitoring for all people with diabetes, and even at times for people with prediabetes. You definitely should talk to your doctor about it. And then in terms of self-monitoring, we are much better today than where we were even a few years ago, where we had to really prick our fingers hard, get a big drop of blood. Nobody wanted to do that. And how useful are those measurements going to be when we only do them sporadically? So today, because of the role of technology, we can monitor. And data really is important when you think about it. especially when you're talking about diabetes. What's your blood sugar levels doing? So tech helps with that. The other thing is the role of data analytics. And you might not think about that. Oh, hey, I have a health condition. Do I need predictive analysis and pattern recognition? And I'd say yes, you do, because that's going to help you and your doctor more effectively manage your diabetes, whether it's type 1 or type 2. So can I predict, based perhaps if you're involved in a sport or a weekend activity, how are you going to have your blood sugar adjusted during that time frame? So if I can predict based on past behavior how I'm going to adjust your insulin or your medication or your activity over the weekend, you're going to have a much better experience. Much of technology and machine learning is about pattern recognition. I could argue much of medicine is about pattern recognition, recognizing signs and symptoms, recognizing labs and the constellation of them. Well, technology can help us recognize that, particularly in the management of diabetes, particularly when we're looking at signs and symptoms, right? Many people may not realize, oh, hey, I'm hungry a lot, or I'm urinating a lot, or I just seem thirsty a lot nowadays. But if you came to me with those symptoms, I'm thirsty, I'm hungry, I'm urinating a lot, I would think diabetes, and so should you. And those of you that are listening that have diabetes know that those often are the symptoms. But as we think about how else does technology help us? Clearly in terms of delivery, and we've seen that in terms of insulin pumps, in terms of the artificial pancreas system, which is going to continue to get better. It has been improving significantly, really over the last 5 years. And I think we're going to continue to see some improvement, but we need to invest in that as well. And then clearly, mobile apps help. Right before, you'd have to write down, in a journal what your blood sugar was. Patients never remembered to bring it to the doctor's office, or you didn't have it with you. But being able to put it into a mobile app makes it much easier, or it automatically loading into a mobile app. Clearly we all need reminders to do things, to be active, to maximize sleep. So reminders can help in terms of technology, and then clearly the alerts. And what's really been useful about the alerts is, as some of you may know, if you have kids with diabetes, it can alert the parents, it can alert another caregiver, particularly if you have low blood sugar or high blood sugar. So that's what I like about the alerts that we really didn't have 10 years ago. And then clearly, I'm going to spend some time on this about the lifestyle management. What's the role of wearables? What's the role of dietary support? And then telemedicine. It's much more than just remote patient monitoring nowadays as we think about how do you get virtual care. But in the past, it could be hard to get an appointment. It still can be hard to get an appointment with your primary care physician or your endocrinologist. But telemedicine is making it easier if you might just have a quick question, or you're having some trouble with your insulin management, or even whether you need to be on another agent in terms of oral medication. And I recognize there are people on the call with type 1 and type 2, so I'm keeping it broad. And the reason why all of this is so important, and you all know this, in terms of if we can get better blood sugar control, if we can live a better life through technology, that's going to reduce complications. That's going to reduce the neuropathy, the retinopathy, and the nephropathy. Diabetes is the number one cause of kidney disease, number one cause of blindness, increases dramatically your risk of heart disease, can even impact your hearing, delays wound healing. We've all heard stories and may know people with amputations because of poor wound healing. So if we can use tech to better manage our diabetes, we should be embracing it. So let's kind of start through, because I want to go over, the things we always talk about. You need to be physically active. You need to eat more healthy. All of that are these general guidelines that we often say to patients, but how helpful is that? So what I'm going to walk you through is, how do you use technology? What are some ideas that might be worthwhile to explore to help you think about these things? Now, we all know about pills for diabetes. I'm going to talk about the GLP-1s at the end. But if I said, is there a magic pill? I'd say the closest thing to a magic pill that we have, particularly for diabetes and other health issues, is physical activity and exercise. It has so many benefits, which I'm going to go over. And what I want you to think about today If you're not already thinking about it this way, I want you to move it from it's like to have, I'd like to go exercise today or be active, to a must have, right? We don't take our pills, 2, 3 times a week, right? We take them every day. Well, how do we be physically active every day, or at least most days of the week? And as we get older and we have busier lives, it really becomes a thing that we don't focus on as much. So I want you to change it from a like to have to a must have. Now, if I can just get my tech to work. So let's go back to this. Whoops. All right. So, how does exercise really help manage our blood glucose? And that's why I think it's important. It creates healthier blood vessels, right? So, diabetes, high blood sugar can damage our blood vessels. So, that can result in strokes and heart attacks. So, we're going to create healthier blood vessels with exercise. It's going to contribute to weight loss. Now, I'll tell you, most weight loss is actually caused by diet, the calories that we take in rather than the calories we burn. Now, exercise does help, and it has many of these other benefits that I'm talking about, but just for weight loss, it's not the most effective strategy. It definitely promotes healthy digestion. We often say if you want to move your bowels, you move. It reduces chronic inflammation, which we know is bad. It increases the sensitivity to insulin. So remember, in type 2 diabetes, there's insulin resistant. Your cells aren't responding to insulin, but exercise helps make them be more sensitive. That's different in type 1, that is a deficiency. And then it may actually change the expression of your genes. Now, when you hear the recommendations of the American Diabetes Association, you hear 150 to 200 minutes of moderate intensity, or 75 minutes, vigorous physical activity every week. You can be like, I can't do that. That's too much. I don't have the time. Or you don't have the stamina to do it. And what I want you to think about is, because this can be very frustrating, because you say, well, I can't do 75 minutes. I can't do 150 minutes. So what do? You don't do any of it because you feel like you won't gain any benefit. But what we've learned is that you gain benefit even if it's 10 minutes a day or 20 minutes a day. The key is to be consistent. And the key is also to slowly increase it. So maybe, and I've had plenty of patients that could do 1 or 2 push-ups and then practice them over time. Move to 5 push-ups a day, 10 push-ups a day. I even have patients that can do 50 push-ups a day now that could only do 1 or 2, 6 months, a year earlier. It's about making that progress and starting anywhere that you're at and building up. These are, I say sometimes these are aspirational goals. You have to get up to that point, but you're still going to gain benefit at any point. And that's really a big measure. And then what about things about high intensity interval training? So often I tell people you want to exercise smarter, not necessarily longer. And there are good data that shows bursts of exercise can actually improve glucose control. That's done in a shorter period of time. This isn't for everyone. It could also cause injury if you're not, well conditioned. But a good example of this is a lot of people will tell me they go on a walk, after dinner, perhaps with their spouse or a friend, or they go in the morning, and why aren't they losing weight? They're doing 10,000 steps a day, which I'm going to come to in a second. And a lot of times when you're doing that, you're on a scroll, you're talking on the phone, you're really not burning a lot of calories. You're really not stressing your heart to work harder. What I say to people, maybe you do a 20-minute walk, but you include a power walk in there. So every minute you power walk for a minute, then you go back to a regular pace. Then a minute later, you go back to a power walk. And then you're spending 20 minutes, but 10 minutes of those have actually increased your heart rate. Something to think about for that. Because this 10,000 steps a day approach that we've been talking about for years, for which there have been data to support improvements in weight and heart function. I'll tell you, we've also seen data at 3 or 4,000 steps a day. It really depends where you're at. So if you're only at 2,000, 3,000 steps a day, and you go up to 4,000 steps a day, that's pretty good. Again, 10,000 steps should be aspirational. You want to get there, but you don't get frustrated if you're only at 7,000 or 6,000. The key is that you want to continue to improve. And this is where technology is so helpful here. Now, if we were all together, I'd say, how many people have on some type of smartwatch? A large percentage of people do. I have a smartwatch on right now. And what it does is, looks at the steps, it looks at the calories burned, looks at these different measures. I'm going to tell you what I've been focused on. A lot of people focus on the steps, and I think that's important. But I really have been focusing on the number of calories burned, right? And ideally, if you want to lose weight, you want to see 2,600 calories burned a day, right? You want to see how much time in the zone. If you don't have any cardiovascular time frame, you're not going to be really improving your metabolic health. So you could have 9,000 steps a day, but if you have no time in your zone, not sufficient calories burned, you're not going to have that progress. So I really want you not just to focus on steps, but the number of calories burned and the time in the zone. That's important. Okay. So those are on most smart devices. I want you to start looking at those numbers. Now, these are not medically grade, so any particular day is not the exact number, but they're still pretty good. And what I do is look at trends. What are you doing on a weekly basis? And I'll tell you, as I burn more calories, that's my priority. I want it to lose weight this year. I have when I look week over week, and I'm trying to get on average 2,600 calories burned a day. Now, what I do like also about these is because this is your personal data, how you're doing. And a lot of times we overestimate our steps. So Gil might have mentioned I still see patients. I do it 1 day a week. And on clinic days, I would think I'm so busy. And then I look and see I only have like 3,000, 4,000 steps. And I'm like, well, how can that be? I'm on my feet all day. And I'm just walking room to room, room to room, room to room that are next door to each other. I'm not really expending steps. I'm not burning calories. That's what I'm really looking at. I don't have any time in the zone, as well as the number of days that you want to have those. So that's what I would encourage you to do when you think about the role of tech in improving your diabetes, particularly as it relates to exercise, which is an important component of type 1 and type 2 diabetes. Now, here's what you don't do. You don't rely upon the treadmills, the ellipticals. Those are notoriously not good in terms of the number of calories you're burning. Now they're good for time, right? Because that's math. That's pretty easy to measure. But in general, I'd rather you use a wearable device than relying on the machine. And this is what we could talk about in Q&A as I continue to talk about these devices. There's a concern that these devices can be expensive. There's often a subscription fee to get more data, to unlock more value, and not everyone can afford it. And often those people that are already having challenges in terms of having a safe place to work, not being able to afford a gym, aren't reaping the full benefits. And that's something that we have to address in terms of availability of wearables, especially in terms of impacting our. And so love to talk about that in the discussion as well, because as we talk about health equity, how can we have all these great tools and devices and not everyone benefit equally? So that's the issue of exercise, right? It has to go from, I like to do it to I really have to do it. And how do I use technology, particularly these wearables, to give me that personalized data about me in terms of how I'm doing in terms of my metabolic health, particularly in terms of the number of calories I'm burning, as well as the intensity of the exercise. So really we have to also move from food is, just something that we eat and enjoy to food is medicine. It's as powerful as a prescription drug. It impacts every aspect of your body. So when you decide, am I going to eat a bunch of potato chips? Am I going to eat an orange? As you think about food as medicine, that's going to help you make the right decision. Now, keep in mind, our health is a result of our daily choices made over. There's not any one day or any one meal that's going to dramatically impact your health. It's the daily choices that you make, right? So, ice cream once every other week is okay, for sure. Potato chips are, okay, maybe, once a week. They're not okay if you're having it at every lunch meal or three of the seven. So that's something that you have to keep in mind. And remember, there's a lot of hidden sugar. It can be hard, and many of you may know this, and you think, especially when I say to patients granola bars, and be like, granola bars are healthy. How can that have hidden sugar? Most of that is bound by some type of molasses or sugar. A lot of the yogurts, unless they're plain Greek yogurt, non-fat yogurt, have a lot of sugar. Some of them, the French vanilla brands, can have as much as a Kit Kat. And you think you're eating healthy. And then you think, why am I losing weight? Why isn't my blood sugar under control? Because there's a lot of sugar in some yogurts, in pasta sauce, in instant oatmeal. And you think, I'm trying to eat healthy. So you do need to check the labels when you have diabetes and really understand where that hidden sugar is. Now, you know you need to decrease red meat, you need to decrease processed meat, sugar sweetened beverages, the consumption of alcohol, highly processed foods, refined grains. You know all that. I know you do. Because when you get diabetes, you'll go to a diabetes educator and you start reading them. But what's the role of tech? How does tech help you do that? And I'm not here to promote any particular product, but what is available are these tech tools. So the first one is called Lumen, and it's really like a breathalyzer. You breathe in and then you breathe out, and it tells you whether you're burning carbs or fat. And you can't always be burning carbs because if you are, that just means you're eating too many carbs, right? This is about you and your diet. And that's what I like about it. And when I was gaining weight, I utilized this and I'd always be burning carbs in the morning. And you really shouldn't be burning all carbs in the morning. You should be burning some combination of carbs and fat. What I realized and what I should have realized is I was really eating too much late at night. I was eating popcorn with my kids, watching movies, and other snacks. So it really helped give me information about me and what's happening to my body and my diet and then providing me feedback to change my behavior. Now, all of these have extra subscriptions and food delivery. But what I like about this, especially at least initially early on, it gives you data about what you're eating, right? So it analyzes your breath and tells you whether you're burning carbs or fat. Now, the next one is an app called NutriSense. There's a free version and then a paid version. And what I love about this is you take a picture of your food and then it rates it for you. So I'll be honest, and here I am a physician, I'm interested in health. I don't really know how much carbs and fat and macronutrients and everything that people have. I mean, I know a little bit, but if I can take a picture of it and it tells me that, and what I love is it gives you either a smile face or this is a smile face. Sometimes I have had a down face in terms of not a good choice. And that can help you make the right choices. A lot of times we need to be eating more protein. And sometimes it can be hard in terms of eating protein, particularly if you don't like meat. Um, and that can help you calculate everything easily rather than you have to write things down, look it up, weigh things, right? But that's not how we live in terms of how we choose to eat. We still want eating to be a healthy and pleasant experience. But an app, think about it, an app can take a picture of your food and it's pretty accurate and tell you the nutritional components. Like that's really exciting. And that's the role of tech. And all of these are only going to get better, right? Very different today. So when we talk about you have to exercise, technology can help you exercise smarter and know how you're doing. I can take pictures. I can analyze my own breath to see how I'm doing and how I respond and how my individual meal in front of me meets my nutritional goals. Let's embrace this technology and improve our blood sugar control. Just a little pitch of superfoods. I'm a big proponent of that. I've included, a list here, not the instant oatmeal that has a lot of sugar, but these other ones, because there are foods that have more nutritional health benefits. So it's just something to think about, courtesy of WebMD. Now, what about sleep? Does sleep really matter? We're talking, sure, exercise matters. You think that's how you utilize glucose. Food certainly matters. It's what you eat, but does sleep really matter? And as you could guess, the answer is absolutely, because the sleep is really about these two hormones, cortisol and melatonin. And cortisol is kind of our awakening hormone, right? It starts to rise in the morning. That's how we wake up. But cortisol also can raise our blood sugar if it's not regulated in the right level. So if cortisol levels are high for too long, our blood sugar is going to stay high. And if we mess up our sleep wake cycle, we're going to impact our bodies respond to insulin. We're going to have more resistance. Our beta cells in our pancreas, which are responsible for insulin, aren't going to function as well. This is where we're talking in type 2 diabetes. It's also important in type 1, but the pathway in terms of what's happening with glucose and insulin are different. But I point this out without giving all the details. There's a physiologic reason why sleep impacts our blood sugar. And that's why it's important to be aware of it. So there are a lot of tech tools that can help us with sleep. And in the middle is the Aura Ring, right? Again, I don't have any business with any of these companies. And all of them give us sleep scores, or Fitbits or Apple Watches. Now, what I like about the sleep score is following it over time, not getting overwhelmed by what the score is. Because the best measure in so many ways is if I ask you, how did you sleep last night? Are you tired? If you say you're tired, then you're not sleeping enough. But sometimes we need extra tools. There are lots of devices. They can be lights that, start to awake in the morning, right? Because light is a measure to go to sleep, or it can be a calming function as well. There can be other measures that we can use these devices to kind of see what our heart rate is and other elements, and then use a guided meditation to help us with our sleep. There's a lot of sleep tools out there and technologies to improve our sleep. We've used weighted blankets for kids. There's data to show weighted blankets for adults can help. That's not high tech, that's low tech. It's not all high tech today. So those are the things that you want to think about in terms of maximizing your sleep. And I really wanted to impart upon you the fact that there is a physiological reason why lack of sleep can result in poor glucose control. So how do you use tech? Maybe it's monitoring your amount of deep sleep, your sleep score. What I find when we monitor our sleep, we tend to go to sleep earlier. We tend to be more focused on our sleep because we know we're measuring it. And that can be a good thing. And then using some devices to help us. And again, we're all going to have those days where we don't have good sleep, but it's the chronic choices over time. Now, what's unfortunate is when life gets busy, life gets stressful, the first thing that we do is give up on sleep. And we really need to rethink that. And there's a lot of tools to help us improve our sleep. Now, what about the mind body connection? We've known about this connection for thousands of years, but we really have ignored it until recently. And I really want to impart upon the fact that there's no physical health without mental health, and there's no mental health without physical health. They're really both connected. And as it relates to blood sugar, huge impact in terms of diabetes management. I already talked about cortisol levels in terms of increasing blood glucose, but also the impact of chronic inflammation and how it increases insulin resistance. So our cells are going to respond to insulin and the blood sugar is going to get abnormally high. And even if we have type 1 diabetes, we're still not going to respond to it as well. So stress certainly plays a key role in the management of diabetes. And what are some of those low tech ways? I'm going to get to some high tech ways that we address stress, but it really is about sometimes we get so focused on we have so many decisions to make. Even today, what decisions did you have to make even before noon? Right? Can you take a break from decisions? How do we connect with others, and not just on the virtual realm, but the real realm? I have a friend who has said every month, he tries to go out to dinner with two friends, just two friends over the course of the month. And it's still a struggle for him because we get so busy. But he has said it also has really improved his outlook on life, just getting together with different friends twice a month. I'm in Washington, D.C. They say, if you want a friend, get a pet, get a dog. We know the impact of, petting a dog. It's kind of hard sometimes to pet a cat, but we know that can reduce stress, the release of endorphins, right? And I just have a few other ideas for you there as well. And then I love the title of this. It's bathe in the forest, a forest bath. When you first say that to someone, they think that sounds cringe, right? You're gonna go bathe in the forest. That you're not taking a bath in the forest. What you're doing is just relaxing in nature. So we're talking about tech. This is low tech. Just finding a park, finding a green space, spending a few minutes in there. Now, clearly, there's a role for tech. And some of you may be old enough to remember the mood rings. There was no real science behind these mood rings. I wish I could see people's faces and they could raise hands if they remembered the mood ring, but it would change colors and that would tell your mood, right? We've come a long way from the mood ring. Now, again, I'm not advocating for any particular technology tool, but there's a lot of apps out there, such as Calm, and there's some free versions of it, and there's this other device called Muse. That's what this headband looks like. Almost remember tennis headbands. This is an EEG guided biofeedback mechanism. This is to help you with meditation. And many people learned about this during the pandemic, where it was really stressful. And you don't have to have these fancy tools, but they can help in terms of guiding meditation. And what I tell people is you just can't go in a room, close the lights, and be quiet and think that's meditation. That's not meditation. It really is something that you have to work at. And that's why I like some of these tech tools, these apps, perhaps, the headband device that some people find useful, other people find it's not comfortable. I'm just putting these in here to get you to think about some other tools and technologies that can help you in your path to manage your diabetes. Things to consider, things to look at, because then you're getting your personal feedback, how your brain may be functioning, how you're feeling based on science, not based on some, mumbo jumbo like the mood ring. Um, and then using a guided feedback. It's something to consider as you're trying to say, hey, how can I improve my blood sugar control? How can I be happier? How can I address this that I have, a chronic condition? And the challenging part of everything that I'm talking about is, as I mentioned before, some of these tools um, cost money. Some of them require high-speed internet to be effective. Not everyone is going to be able to benefit. And that's an issue that we need to address because everyone should have access to these tools. Because remember, I talked about this is monitoring, right? This is about personalized data. I'm getting back the impact of stress on me. I'm getting back how I'm doing on this exercise. I'm getting feedback based on how I respond to this food. That's what we all want in terms of management of diabetes, how it impacts us on a personal level. And now we're getting the tools and the technologies to do that. Now, I want to just briefly talk about the GLP-1s because as we talk about technology, technology allows us to find new medications. Now, what's interesting, as many of you know, GLP-1s have been used for the management of type 2 diabetes for some time. Now they're all the rage in terms of obesity management. And for some people, it's been having trouble getting their medication for type 2 diabetes. Now, as you may know, the dosing for GLP-1s for obesity is different than it is in type 2 diabetes. But this is an area that of research that is really exciting about how we manage obesity, which we know is a main culprit in type 2 diabetes and pre-diabetes, as well as we manage diabetes in general. Now, I have to tell you, now even prescribing the GLP-1s for obesity or even for diabetes, you still have to make lifestyle changes. You still have to eat healthy. You still have to be physically active. You still have to manage your stress levels. You still have to focus on your sleep. That doesn't mean that you can continue to live a lifestyle that you're living that may be unhealthy and then take a GLP-1 and you'll lose weight. That's a concern. I have had some patients, I say to them, have you changed your diet? They'll be like, no, I just eat less because it has an impact in terms of us feeling full. I'm not here to preach, but that's not good enough, right? You want to change some unhealthy behaviors as well. Now, what we need to see with the GLP-1s is in terms of weight loss it's not just fat, it's also muscle. And there's this concept called sarcopenia, right? Where we don't want to be losing too much muscle. As we age, we automatically lose muscle mass just because of aging. And if we lose too much muscle mass, like an alliteration, if we lose too much muscle mass, we're at risk of fall, we're at risk of injury. And as we get older, that can have significant impact on our health. So I just want to mention that about the GLP-1s. Everything has risk versus benefit. Certainly, they play a role in diabetes management. Now they're playing a major role in obesity. We'll learn more over time. So Gil mentioned I wrote a book. I'll be happy, to talk about it. This is my contact information. I certainly answer my own emails. So if you want to send me a note, I will do so. Um, and with that, I wanted to open up. I know folks always like questions. So I wanted to open up to questions that folks might have over the next 10 minutes or so. And if you're shy about it, you can always send me an email and I'll answer it. With that, I'll turn it back to Gil and folks to see what questions folks have.
John, Dr. Whyte, first of all, thank you. This was exceeded all expectations, and you're weaving the concept of personal technologies dedicated, obviously, to diabetes care management and other digital health wearables and technologies that augment our healthy lives, combined with diet, exercise, new medications that are coming on. It was a sort of a brilliant overview of how technology can improve our lives, and thank you for that. This conversation, this video is invaluable, and I'm glad that the American Diabetes Association will be sharing it. I also want to thank you for reminding people that you dedicate yourself to see people who have health needs in the clinic once a week, and I know from previous conversations how surprised they are when you move back the curtain and step in and they realize that their internist that day is Dr. John Whyte of WebMD. It must be quite a surprise, but a delightful surprise. John, while we're waiting for people to think of questions, I do have a few.
Sure.
I hope that you'll feel comfortable answering. You talked about a number of technologies. Are there a few that you've mentioned that you actually do deploy in your personal and family life? Because I know that you practice what you preach, and I know that you seek to look at your diet as well. You seek to look at food as sort of an extension of good medical care. So, are there technologies that you personally use that you don't mind sharing with us?
And Gil, as you know, I try a lot of different things because I also want to be able to understand the user experience, and I want to be able to talk to patients and others about my experience and what might work with them. One simple thing that I'm using that everyone should have access to is a scale. I've chosen more Withing scales, which gives more data about your bone densitometry and your body composition, what percent is muscle mass, bone mass, fat mass. I look at those on a relative basis, right? So I don't think they're the most precise, but over time, if there's changes, that's helpful to know. And I made a commitment to myself that I measure it every Saturday morning. And that's a good thing to do about weight because it fluctuates over time. And, I do think one has to have data. It doesn't have to be every day. I choose once a week. And then I look at it over time and it's connected to an app, which I like because then it plots it over time and then it can give me some feedback. I do use a Fitbit just because I'm very interested in steps, as I said, and calories burned and in those measures and a concept of heart rate variability. So I think that's important as well. I have used for many months the Foodvisor app just because I had found that to be, I used the free
That was
version
fascinating. That was
to take
fascinating.
pictures, and it gets better over time. And I have used the Lumen device early on during the pandemic because I wanted feedback in terms of what am I eating. I've used a CGM, and I don't have diabetes or prediabetes, but I wanted to understand what the user experience was because sometimes it feels like, oh, Is there a needle in my, arm or in my stomach? And I have to tell you, you really don't even notice it after a couple of days. And I love the comment from a good friend of mine who said to me, you ignore the first 3 days. First of all, it's calibrating, but you know you have it, so you're doing better because because you're concerned your doctor is going to look at it. And after 3 days, you just resume your normal patterns. And I liked it because what I saw is over a month period of time, when I exercise, my blood glucose was much better. Or when I eat pasta, maybe because I'm Italian, I didn't have as high glycemic excursion as sometimes you would think. And I actually put a few of these values up on Twitter before it got rebranded, and it was like crowdsourcing. People would give me comments as to, oh, maybe it was that latte in the morning that you had for your blood sugar. But any of these, and different ones are good for different types of persons and lifestyle. But as you and I have talked about, and what I wanted to transmit to people during, today's webinar is the availability to collect your personalized data on a continuous basis. And that's what I think is so important on a daily basis. So, what's my sleep on a daily
Mm.
basis that I look at over time? What's my stress level on a daily basis that I'm looking at over time? And then how do I correlate it to other information? Because it's so easy to say, well, I'm going to try to lose weight. I'm going to try to eat healthier. But when you're able to take a picture and have the data right then, it makes things easier and it helps you make better choices. And that's what I think is important is we're understanding the role of metabolic health and how we really have to focus. Because then what do you do? Particularly if you have prediabetes or type 2 diabetes, you might go in. I mean, you should be going in twice a year, maybe more. You might go in once a year. And then what's that blood sugar level that day or your blood pressure that day? Really, how valuable is that? As you and I have talked about, health happens in the home nowadays. And now we have the ability to monitor that over time. Even if it's not medically grade the exact number, let's be honest, it's still pretty good. Now, sometimes too much data can be a challenge, right? I don't want people to get overwhelmed by it.
It's
But most of
information
us, yeah,
anxiety.
yeah, most of us aren't doing enough about collecting this information and then utilizing it because it's about you. Like you see how you respond to a particular type of exercise or a particular type of food, or how your sleep is when you go to bed at 9 p.m. versus 10 p.m.,
I
right?
wanted you said something, and I was thinking that I definitely wanted to ask you that this is
Yeah.
a next question. And one is we're talking about technology, and you quietly weave into the conversation appropriately behavior.
Mhm.
And I wanted to ask you about the context of support. Diabetes is a household condition.
Yeah.
It's not just the person who is diagnosed with diabetes, there's other people in the house. And so I wanted to get your impression, your advice as an internist who cares passionately
Mhm.
about people's well being. What's your advice to the person with diabetes in terms of getting the support from the people in their
Yeah.
household to better manage that diabetes?
And it can make or break it for many people, especially if you don't prepare your own meals or you have to create different meals for different people in the house. That can be very challenging. Um, so it certainly plays an important role. And it's really about educating others as well. There's still a lot of misconceptions about diabetes and blood sugar control. So it really is about, first information, and it can be confusing out there in terms of what you eat. It's not just all about sugar. Sometimes people think that if I just decrease the amount of sugar I eat, like then it's all going to be okay. But it's more than that, and it's educating people that. I often say to people too that taste is acquired, right? We're not born, although there's some debate about this, to be pre-programmed to say that we like, ice cream, right? There are lots of choices nowadays, and we don't let our kids get away with something if they eat something once and say they don't like it. We say you often have to try something 7 times before you can decide whether or not you like it. So it's really about, helping educate family members, caregivers about your condition, seeing how they can help you, right? Sometimes it's good to ask people for help so they feel they also have a commitment to
Uh,
participate as well. But at the end of the day, you have to think about yourself and make your choices, especially as adults.
I also wanted to get your advice for our listeners
Mhm.
on monitoring. And obviously, there's a number of blood glucose monitors that
Mhm.
diabetes nurse educators can recommend. If you go into your
Mhm.
pharmacy and look behind the counter, they have a whole
Sure.
display of glucose monitors
Mhm.
for people with diabetes or concerned about
Yeah.
their blood glucose. And I remember a trial from the
Mhm.
mid 1990s, the diabetes complication and control trial, that talked about tighter monitoring
Sure.
results in better health. And you talked today about the technologies that are accessible now.
Mhm.
Um, without putting you on the spot as an expert from
Mhm.
WebMD,
Mhm.
as someone who sees
Mhm.
patients, as someone who is really looking at these different technologies, and as an author, your book, Take Control of Your Diabetes, which I hope you'll speak to for a few
Mhm.
moments. I want to get your sense, how important is it for someone who has type 2 or type
Yeah.
1 diabetes to
Sure.
monitor their blood glucose?
Well, for patients with type 1 diabetes, they know that it's very important for good control. And they have insulin deficiency and they have to take insulin. So it's important to carefully measure throughout the day because there are risks of low blood sugar and risks of high blood sugar. Now, for type 2 diabetes, there's been lots of trials, DCCT, DPP, lots of big trials over the last few decades. It really depends their level of control to begin with. Everyone doesn't need that has type 2 diabetes, everyone doesn't need to measure it every day. Some people can just get their A1C measured every few months. But what these tools also do, even what I have found for some patients for short periods of time, to use a continuous glucose monitor, maybe for a month or two, to kind of see what your reactions are in terms of certain foods, to understand how behavior change impacts blood sugar. That's important because I'm getting feedback right then. So everyone, kind of cliche, everyone is a little different. And for type 2 diabetes, in terms of how often they need to monitor. Everyone needs some degree of monitoring, certainly in A1C, probably every 3 to 4 months. And then it depends in terms of their current control. That's really kind and what medications they're on. You can be an insulin requiring type 2 diabetes, and then you're going to need to be checking your blood sugar, typically on a daily basis. Or if you're having challenges or if you're not feeling well, you might need more frequent monitoring. And that's where having a good discussion with your doctor is really important.
Now you've written a number of best-selling health books. One of them is Take Control of Your Diabetes, and it's a two-part question. Um,
Mhm.
One is your knowledge of people and certain non-communicable health conditions is
Mhm.
expansive. You chose diabetes as one of your
Mhm.
books. It became a bestseller.
Mhm.
Could you share with us why you chose diabetes to write
Sure.
about? And then also a little bit of highlights of the book, because I know it is very, very popular.
Yeah.
And I hope that people listening will explore, getting that book
Sure.
and learning more about how they take control of their
I have it here
diabetes.
behind me. It's in
I hope
purple,
so.
but
I,
it's
I
it's
hope so.
got
I hope so.
so it's really for those people with type 2 diabetes or pre-diabetes. Because what the focus is on most diabetes for type 2 is not caused by genetics. There is a small percentage. Most of it's caused by lifestyle. So it's what we eat, how active we are, the amount of stress in our life, and our sleep. Those really all contribute. And we've learned over the last 10 years or so that some elements of type 2 diabetes can be reversed. We used to think that once you have the diagnosis of diabetes, your beta cells are already destroyed. Now, what we believe is that we can restore function to those beta cells, especially if we work early to get your blood sugar back in normal range. And that's really what I talk about because there's a lot of information. What do I eat? Is it Mediterranean? Is it paleo? Is it keto? Do I do high intensity? Do I, do all cardio? What should I do? Trying to provide some guidance on that. Even from the idea of directly from the book is how do you change your concept of exercise, right? What's your relationship with it? And for most people, it's I'd like to have it. I'd like to do it, Dr. White, if I had time, as opposed to saying I really have to do it every week.
Mm.
But also pointing out it doesn't have to be 10,000 steps right away. Don't get frustrated by that. It's really providing the diet plan in the book and an exercise plan because people will often say, tell me what to eat. Tell me what exercise I should do. Now, everyone is a little different, but sometimes you have to start somewhere with some tips and tools and find out. And it really is about you have much more control of
Mm.
your type 2 diabetes than you realize. And
Wow.
even from the perspective early on, sometimes we are too quick to push medication, depending upon what your blood sugar is to begin with, right? Automatically start medications. And if we really provided a comprehensive strategy of healthy eating, physical activity, other lifestyle changes, many people would be able to minimize the risk of medication or not, especially if we do it early on. But the problem, Gil, is you come in and I tell you your blood sugar is high, you might have prediabetes. For a variety of reasons, you don't come back for a year, maybe 2 years from now. Maybe it's a little higher. You're like, oh, Dr. White, I'll make changes. We say, okay, and then it's another year. Then all of a sudden, it's way too high, and you're like, oh my gosh, how do I have diabetes?
You've
Um,
graduated to type 2
I've seen
diabetes.
that. I see that all the time, Gil. And this is about, hey, if you have a diagnosis of prediabetes or type 2, this is a wake up call. You need to make changes now because now is
Yeah.
when you're going to have the most impact.
So our conversation has stimulated some questions, and I just want to share
Yeah,
those with you. One
sure.
obviously jumped right out from the audience, prediabetes. And the questioner says, 1 in 3 Americans, it's about 90 million
Yeah,
Americans, by the way, are pre-diabetic. And this is obviously a major public health concern. How can technology potentially help us
yeah.
to elevate people's awareness and their risk factor?
Yeah, and most of that is due to obesity, and I think that the new medications are going to have an impact on that. But here's the aspect of technology. So if we talk about whether you have the scale that gives you your measurements and sends it to your phone, so you don't have to be putting it in. If you can use continuous glucose monitor to tell you, how you're doing for a month. If you can use an app to help you make the healthier food choices, right? So you don't have to say, is it Mediterranean or is it keto or is it French cuisine, you can look at it and see yourself and have that number. So you may not know what's the total number of grams of protein that you need, but if one has 2 grams of protein and one has 10, you're going to know the healthier choice. If one has 16 grams of sugar versus 3, you instinctively know the healthier choice. So that's where tech comes in.
That's brilliant. And just a last question, of
Sure.
course. I wish we had another hour, but fortunately, we've had this hour together. And on the behalf of the American Diabetes Association, I want to thank you, Dr. Whyte. You're the consummate public health educator. Obviously, WebMD is fortunate to have you, but I would say to some extent you've become America's primary care physician and internist, and we all thank you for that. So, one last question?
Sure.
We've talked a lot about people with diabetes. I wanted to sort of shift specifically to diverse populations and perhaps even children.
Mhm,
They say we have one of the one nation that has some of the heaviest children on
mhm,
the planet right now, the developed nations or the urban diet, as they call it.
mhm, mhm.
Any last minute advice to parents in terms of addressing their child's diet needs or exercise needs,
Yeah.
or to
Yeah.
avoid their becoming pediatric,
Sure.
pre-diabetic, or diabetic?
And many parents are struggling to make the best choices. It can be expensive to eat healthy in some areas of the country in terms of there's not a lot of grocery stores, there's not safe places to be active. They might have to work multiple jobs. I mean, the key really is to think about these components in terms of it is about, what calories one are consuming, the amount of physical activity, and it's really about educating oneself. There are a lot of healthy choices that can be inexpensive, but it's not readily apparent. all the time in terms of what those choices are. So it's going to, websites like the American Diabetes Association to find out the best information, WebMD and others to really educate yourself, getting those appointments with your doctor to check your child's progress and really trying to manage their weight. For people with type 2 diabetes, that's the biggest issue. Type 1 is a completely different issue with different elements. But as always, it is great to talk to you, Gil. And thank you for the opportunity to try to give people a little more information about how they might be able to use tech to ask more questions, to look at more tools and devices, and really get some support to help them in the management of this chronic condition.
Thank you. We've been listening to Dr. John Whyte, Chief Medical Officer of WebMD. Dr. Whyte is the author of the health bestseller, Take Control of Your Diabetes. And in our conversation today, Dr. Whyte has been sharing with us background on the combination of how technology can actually improve our well-being and help us best manage diabetes care. Dr. Whyte, again, our thanks to you.
My pleasure.